Hello, everyone. It's June the 10th on Thursday, and while I'm going to read to you, I'm going to read 26 deaths. This is a continual process that DHHR is doing, to reconcile the official death certificates. We had 18 of the 26 that are reported today that are reconciliations from April and May. But we have a total of 26 deaths that I'm going to read to you today that we have not read thus far, but remind you that 18 of those 26 were reconciliation from April and May. The 2800th and 23rd death is a 41-year-old male from Lincoln County. The 2824th death, a 58-year-old male from Mineral County. The 2825th death, an 85-year-old male from Ohio County. The 2826th death, a 67-year-old female from Boone County. The 2827th death, a 79-year-old female from Berkeley County. The 2828th death is a 79-year-old female from Berkeley County. The 2829th death is a 71-year-old female from Berkeley County. The 2830th death is a 97-year-old male from Hampshire County. The 2831st death is a 56-year-old male from Raleigh County. The 2832nd death is a 60-year-old female from Kanawha County. The 2833rd death is a 78-year-old male. The 2833rd death is a 78-year-old female from Hampshire County. The 2834th death is an 84-year-old female from Mercer County. The 2835th death is a 77-year-old female from Raleigh County. The 2836th death is a 73-year-old male from Putnam County. The 2837th death is a 70-year-old female from McDowell County. The 2838th death is an 89-year-old male from Wood County. The 2839th death is an 88-year-old female from Jefferson County. The 2840th death is a 78-year-old female from Jefferson County. The 2841st death is a 78-year-old female from Cabell County. The 2842nd death is an 86-year-old male from Jefferson County. The 2843rd death is a 78-year-old male from Boone County. The 2844th death is a 65-year-old female from Cabell County. The 2845th death is a 69-year-old female from Cabell County. The 2846th death is an 86-year-old female from Kanawha County. The 2847th death is a 93-year-old female from Harrison County. And the 2848th death in West Virginia is a 61-year-old male from Randolph County. 2,848 deaths. You remember back when we had our first death, how tragic we thought that was. Do you remember back when there was some reporting service in Washington State that they were forecasting the total number of deaths that we would have in different states across our nation. At that time, we had like 36 total deaths. And they said that they were forecasting in West Virginia, when this thing ended, we would have 74 deaths. We've had 2,848 deaths in West Virginia. And we're leading the nation in almost every account. Or we have been leading the nation in many, many, many accounts. We've got border counties all the way around us, no ocean to protect us. We're within a rock's throw of 2/3 of the population of the country. And really and truly, we've lost 2,848 people. It's far, far, far less than our neighbors, but yet it's unbelievable. It's totally unbelievable just how tragic this thing's been. And in a conversation yesterday with Dr. Marsh and General Hoyer and everything, they again reiterate just this: it's not over. It's not over. You have the opportunity to make it over. But right now, it's not over. And what do I mean by that? I mean get vaccinated. I might as well go into this and everything before I go any further and everything, just tell you this. Yesterday, there's a really exciting company, Data Robot, who's coming to West Virginia. In fact, it's come. They've started hiring people. Absolutely, they think there is a real chance down the road that this could blossom into hundreds and hundreds and hundreds of jobs. They're really excited about being in West Virginia. They're going to be in Morgantown. They're really excited about the partnership they have with WVU and all the good stuff that's going on. I went yesterday. I flew to Morgantown yesterday to be part of that announcement because it is very exciting. And when I got on the ground, one of the people that works on my staff came up to me and said, Governor, you've been exposed to someone directly that has COVID and everything, and it's been tested positive, and you've got to be tested right now. You were exposed last Friday, so really and truly, you know, I'm right in the sweet spot, 5 days away, you know. So nevertheless, you know, I went to the parking lot, and at the parking lot, they sent a nurse out there and everything, and swabbed me, and then they went back to take it back to find the results. The right thing for me to do, I mean, even though the CDC guidance say you're still good to go, you could have gone in the press conference, I didn't do so. I sat in the parking lot and went on Zoom because really and truly, the last thing in the world that I want to do is be someone that is infecting others, and be someone that could very well, absolutely, infect somebody that it takes their life. So I stayed in the parking lot, did the press conference on Zoom, and then went back. I got on the plane, and when I landed, I got the results that they were negative. We all felt that they were absolutely negative, but as just an added level of precaution, there was no way I was going to go in there without knowing that that test was negative. Now, if it rose to the occasion that I needed to be tested, it sure rose to the occasion that I didn't have any business going into that press conference. Now, all I tell you that for is just one thing and one thing alone. You can't stop this. Everywhere you go, people that have been vaccinated, truly, the likelihood of them being infected with this is minuscule. The likelihood of them being hospitalized, almost zero. The likelihood of death of somebody that's been vaccinated, super zeros. Now, with all that being said, you can stop it, but we got to get you vaccinated. I don't care how hard-headed you are. I don't care of all the stuff you've got to do and how inconvenient that it may be. We have got to get you vaccinated. From the standpoint of our elders, our parents, our grandparents, we have got to have your help to get the kids vaccinated. And we got all kinds of exciting things we're giving away. That's great. But we have got to stop all these people dying, and you have the power to do it. You got to step up. You got to step up right now. In other words, you've almost got to be what I was yesterday. Here we had an incredible announcement and everything, and everybody there and everything. I was there. And I could have absolutely just said, okay, look, all the CDC guidelines. In fact, Dr. Marsh and General Hoyer told me the CDC guidelines say you're okay, you're okay. But would it have been right? You know, would it have been right that if I had risen to the level that they felt I needed to be tested right then, would it have been right to have gone in there without knowing the results of the test? Now, I don't think so. I absolutely don't think it's right for us to have all kinds of folks, as safe as these vaccines are, walking around saying, nah, I'm not going to do that. I'm just not going to do it. Well, that's your prerogative. But really and truly, you're putting at risk a lot of folks. Not only yourself, not only your family, but a lot of folks. every day, I sit here and read about more and more West Virginians that we've lost. Remember, there was a time when there was a rating agency that said, we predict West Virginia is going to have 74 deaths. And I sat there and said, boy, I hope and pray we don't get to that level, because we're at 36 now. And I really hope and pray we don't rise to the occasion of almost or more than doubling where we are now at 36. We're now at 2,848 deaths. 2,848 deaths. What I'd give to be 74. What all of us would give if we were just 74. We can stop it. We can stop it now. You've got to be willing to step up. You have to be willing to step up. We had 119 new positive cases in the last 24 hours, and our daily positivity rate, 2.26. Our cumulative rate is at 5.05. Our active cases are 3,229. We have 156,000 plus that have recovered. We have 133 people in the hospital and 54 in the ICU units, and we have no red counties. We have no orange counties. Look at all the green. Look at where we're going. Absolutely, the only stipulation is we got to stop the deaths. We can do it. We can do it with vaccinations. I remind the 65 and older, if you happen to get sick in any way, absolutely, without any question, if you're sick in any way, you feel any kind of symptom, even just being anxious, go get a test. These antibodies can save your life. Now, I got some real good news to report to you and everything, and that is yesterday we went to the market with a bond on our Parkway bond sale of $333 million. Now, again, I'm not tooting my horn. I'm just telling you fact. I always try to tell you the truth. But there was a bunch of folks in my inner circle that really felt like we needed to go to private sales. In other words, we couldn't go to the market and depend on the market believing in West Virginia, even though we believe in it. We couldn't really go to the market. And I said, hogwash. Then I made the decision. We're going to the market. We're going to the market because I know how well the outside world gets it to how well West Virginia's doing. Well, we went to the market. Now get this. When we go to the market, there is 11.6 times the people that are trying to buy our bonds than the amount of 333 million. 11.6 times is the demand for our bonds in West Virginia. And we end up with a 2.62 interest rate, and we end up on a 30-year bond, and we end up with a $90 million premium. Free money, because the outside world believes, and we went to the market. So another terrific announcement and everything, that we pushed the right buttons, did the right things, and this is the second tranche of the toll revenue bonds under the Roads to Prosperity, under my Roads to Prosperity program, and I couldn't be more happier. A lot of really, really good work. You know, the Roads to Prosperity program continues to pay dividends and works all across our 55 counties. There's a lot of great people that are out there doing the great work. You know, today, and the reason we pushed the briefing back just a little bit, a really close personal friend of my family. His mom passed away very tragically, and it's the Cochran family. Mrs. Cochran was going to be 99 years old in the month of August, and what an incredible mom, and what a family. I mean, what a family. Bob has worked with me, in my businesses, for years and years and years, and his brother Joey is an incredible contract. There's so many. I mean, it's all there's to it. Tom Cochran runs the Beckley Airport, the Raleigh County Airport, and does incredible work there. They just keep on ticking and keep on working and everything. But an incredible family, and all the kids, and the sisters and everything. I'm not going to get into everybody, but I'd surely like you to keep them in your prayers. They're having a tough day today, but what an incredible family. Like I said, I talked to you about the data robot people and everything, and how excited we are about having them come here. And I talked to you about, my negative tests and everything. Now I've got to tell you this, that we're going to have free fishing in West Virginia, where anybody can come out on Saturday, June the 12th or June the 13th, and enjoy these 2 days, whether they're residents or non-residents, are able to fish in West Virginia for free. It is unbelievable. Look at that picture. I mean, it is totally unbelievable what this great state has to offer. And so enjoy those days, and it's almost, it's very, very infectious. When it really boils right down to it, we have more and more of an increase in license sales. The DNR people are doing fabulous work. I had the opportunity to be with them, last week, and it was a terrific day. What an enjoyable day that was, and everything. And to see just all the great work that they're doing, and whether it be, stocking of all the trout or channel cat in our lakes all across our state, 59 different lakes, or all the great work that they've done in trail development and native brook trout, and just on and on. The bringing elk back to West Virginia. It's just so many different things that they're doing. This state has so much beauty. It'll touch your soul in every way. Get out and go fishing. Go fishing and enjoy these couple of days and everything. And like I said, it will be something you'll want to continue on, and we'll love having you in West Virginia. So enjoying nature and enjoying all the great stuff that's out there. As far as vaccine eligibility, I'll get through all this pretty quickly, but vaccine eligibility is 12 and above. We've got 70,000 people that are registered now, and I'm sure that number's higher because I think I reported 70,000 on last Tuesday. But if you haven't registered, you're really missing out on something big time, because in this situation, when we draw for $1 million, it's not going to be the numbers, where, your chances of winning are significantly increased from the normal lottery. We're going to give away, like I said, we're going to give away full ride scholarships. We're going to give away, trucks and shotguns and rifles and hunting and fishing lifetime license. We're going to give away brand new, outfitted trucks and everything, and it's going to be a lot of fun. And we're going to start that on our state's birthday on June the 20th, on Father's Day, and that'll be the first tranche, and we'll do that every week through August the 4th. In order to be eligible, you got to be vaccinated with the first shot. We called it "Do It for Baby Dog." There's lots and lots of people that are really excited about that. And it's a little humorous and everything, but it's a neat little thing. I've been told from sign companies that people are calling in wanting to put a sign in their yard, "Do It for Baby Dog," and so Baby Dog's gotten more popular than me, but that's no problem. I love that in every way, and I would just encourage all of you to get a sign and put it up in your yard and everything. And that's a signal that you are pushing everyone and advocating to everyone to do it for Baby Dog. Get vaccinated. Get vaccinated. Like I said, I don't see how you can look at that English Bulldog face and not smile, but nevertheless, you know, we got to get people vaccinated. All of our young people, you know, again, I've been through, I've said, you know, asking the parents and grandparents to help us with our young people. All those 16 to 35 will be getting that $100 savings bond or the $100 gift card. We've crossed a milestone, as I knew we would. Now we're at 60.1% that have received their first shot of the entire population. It's fabulous, fabulous, fabulous. We're at 76% of all those 50 and older, and we're at 84.7% of the 65 and older. It's great stuff, really good stuff. I talked to you about our businesses and our churches. You know, if you'll just call us, we'll come. We'll do your employees, we'll do your congregation. Just help us to be able to help all kinds of others. You know, from the standpoint of the vaccine info line, it's all up there. From the call to arms and everything, we're going to get rid of this mask mandate. We're going to get rid of the mask period, and we've already done so for people that have been fully vaccinated. It protects you. I mean, just think, you know, I'm 70 years old. You know, I'm surely a little chunky. Just think of when I've been exposed myself. All those kids on my basketball team. Now a situation with doctors, not my doctors, doctors that I was greeting and everything. And one of them, lo and behold, has got COVID. You know, so I have had many opportunities to get this, but I'm vaccinated. You know, the likelihood is very, very low. You know, without any question, it probably saved my life. You know, so with all that being said, you can have yours safe too. Take advantage of all of our free testing and everything. Thanks again to Walgreens and Proof for all that they've done and everything with the drive-through testing and everything. Take advantage. That's all I tell you. Just take advantage. Long-term care facilities are down to 5 outbreaks. Yeah, that's great stuff. Good stuff. Churches down to 4 outbreaks in 3 counties. Great stuff. Monroe, Nicholas, and Pendleton County. We need to get that cleaned up. Get this one. At our corrections all across the state of West Virginia, you know how many inmates are infected? 0. 0. 0 inmates and 2 staff. How can we say anything except great work to all of our corrections people? Unbelievable. Unbelievable what a job they've done. Unflat believable. You know, now, the last thing I'm telling you is if you've recovered from this dreaded killer, 2,848 didn't. 2,848 did not. If you've recovered and everything, go give blood. Go give blood. You surely owe yourself and God above and all of us to at least consider it. And the last thing I'd say is, and I'm not just dogging people, but I am telling you, if you let these 2,848 people just die in vain and let this thing continue because you're too hard-headed to get vaccinated, that's not right in my book. Nevertheless, thank you a bunch.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon, and I'll be really short today. I think the governor has really said what we all feel so deeply, in that we know that these vaccines not only save lives, but they also stop the spread and they stop the production of new variant forms of COVID-19. So not only by being fully vaccinated do we ensure that we protect ourselves, but we also protect each other, and that is so important. Dr. Fauci came out this morning and was very much in the same mode the governor talked about earlier, in that we can't drop our guard. We're not done with COVID yet. And the concern is and it's not the most common variant in West Virginia. We don't see any active cases of this variant, but we know it's coming and we have time to prepare ourselves. And this is really the time that we all need to step up and choose to be vaccinated. vaccines are incredibly effective in reducing your risk of getting infected, of getting sick and dying from COVID-19, but also importantly from being able to spread it or to allow COVID-19 to mutate inside of you, because it only mutates in people it infects. Today also, Johnson & Johnson, working with the Food and Drug Administration and the Centers for Disease Control, have found that we can extend the shelf life of Johnson & Johnson from 3 months to 4.5 months, and that's good news. And we certainly believe Johnson & Johnson is a very good vaccine, like we believe Pfizer and Moderna are. Again, Johnson & Johnson 1 shot, not 2. And so we encourage all West Virginians to choose among these vaccines as all being highly effective and beneficial vaccines. The other thing is that President Biden has agreed to purchase and ship 500 million doses of the Pfizer vaccine to places in the world that lack that vaccine, which is really important, because what we know today is it's not only important to have our state and our residents all vaccinated and safe, no more deaths, no more spread in West Virginia, but because things are so tightly connected in all parts of the world, that if other parts of the world don't vaccinate their citizens, then eventually the variants, the changes, the mutations that happen in COVID-19 that eventually give us more capable viruses that can avoid immune system because of their changes, the new variants that will come will eventually also affect us. So it is really in our best interest that we are world leaders, as well as in West Virginia's interest that we are leaders in our country, and that we want everybody to be able to have the chance that we have today. So we all are very grateful for the work that's been done. We have seen our rate of transmission, the new cases are going down, hospitalizations going down, and we've seen a beneficial effect on deaths, but we can do better, and we can take that beneficial effect and make it zero, so nobody in West Virginia dies or suffers from this virus. Thank you so much.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Just one update for folks today. Johnson & Johnson vaccine expiration dates have been extended from 3 months to 4.5 months. For those who want to continue to get a one-shot opportunity for a vaccine, we have plenty of Johnson & Johnson vaccines available, and the extension of the time gives us additional time to use those doses, as well as to work with others around the country and possibly around the world who may want to use those doses. Thank you.
Thank you, sir. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good afternoon. It is with great sadness that I report that DHHR has lost another employee to COVID-19. Our Bureau for Child Support and Enforcement has lost a staff member from their Greenbrier County office. Rochelle Humphreys Evans was just 49 years old. She was with the Greenbrier office 22 years. We extend our deepest sympathies and condolences to her husband, Larry, and to her daughters, stepdaughters, and grandchildren. COVID-19 is truly a horrible and heartbreaking disease. I urge everyone who is vaccine eligible in West Virginia to please get vaccinated. As the governor said, this is not over. Please keep Rochelle and her family in your thoughts and prayers. Thank you.
All right, thank you, Secretary. Dr. Ainamjad, our State Health Officer, had a prior engagement today, and she will rejoin us next week. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you go into a little bit more into explaining why the DHR needed to reconcile these numbers? I know we just instituted the electronic death reporting system. So could you tell me what happened there? How did this end up happening again? Thank you.
Charles, I can't go into any more detail on it and everything, but Secretary Crouch can and everything. I think this is an ongoing thing that all states across the country are dealing with and everything, but Secretary Crouch, this is yours.
Yes, sir, Governor. Yeah, Charles. The issue of the death certificates being reconciled, that goes on weekly. We are still dealing with a system that is not very quick in terms of getting that information throughout the counties in West Virginia. The contract that we entered into with a vendor to put in an electronic system is going smoothly and on track. But the deadline or the date for that implementation is really January 1 of next year. So we're towards the end of the year if things go even a little faster than we think. But we have a good vendor that provides these services in other states. It's a complicated system, but we will have all that online by the beginning of next year. So thank you.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and fellow reporters. I see there's 133 hospitalizations today, the lowest number since August 27th. About 3,200 active cases. That continues to go down sharply. And roughly 49% of the eligible people in this state, 12 plus, have now had both shots. They're fully vaccinated. Governor, I'm wondering, and I'd like the medical, Clay Marshall weigh in too, because I'd like a medical opinion on this. Given how well the numbers are trending, is it possible you could end the mask mandate before the state's birthday on June 20th? Could you maybe pull the trigger a week earlier? So I'd like to get your thoughts on that and have the doctor weigh in as well. Or is that medically worrisome to do it too soon?
Mark, first and foremost, I'm going to listen to the experts and they're going to advise me, but I think we picked, our state's birthday, and to be perfectly honest, if we were within a week and removing it a week early, yeah, that surely would make some of us feel better and everything. But if we're within a week, we can stand it another week. It's been a long road. It's been a long road for all of us. I'm not an advocate of loving the mask by any stretch of the imagination, but I think we can make it till June 20th, and we're still trying to get that total of our eligible population is 65%. We're at 60.1 today. First time we've been at 60, and I think by the time we get to June 20th, we'll be really, really close, and we're going to get rid of these masks on June 20th for sure. But Dr. Marsh, if you'd like to add something, you can.
Thanks, Governor. I think that you've said it perfectly. Mark, we are always wanting to make sure that we are protecting each citizen from being read as a statistic on the initial comments the governor makes every press brief, and it breaks all of our hearts to have to read more names on that list. So as we help people choose to be vaccinated, and as people decide to protect themselves and protect each other, then it keeps that list shorter and shorter, and we hope it goes down to no names on that list. So we really want to get more people vaccinated, and as the governor said, we have targets for June 20th, but that is not the end of what we want to do. We want all West Virginians to be fully vaccinated. That's when we'll feel like we've done our job well.
All right, thank you, Mark. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Hope all is well. Governor, we are coming up on the 5-year anniversary of another West Virginia catastrophe, one that hit you and your friends and your neighbors. I'm talking about the flood of 2016. I have a question for you and possibly for General Hoyer based on your past experience and knowledge. That's up to you. But the state's general fund is running a surplus, and West Virginia is receiving millions of federal dollars too. So I wonder, in light of the 5-year anniversary, as we reflect, should West Virginia put additional money into flood mitigation to try to protect the state from future disasters? Thank you.
Brad, I don't know that I am versed enough to give a real opinion, but I'm going to give you my heartfelt opinion. And you know this, and the general knows this because he was right there with me. But I've never been through anything in my life, as far as other than maybe my dad passing away or whatever. But I've never been through anything in my life that touched how difficult that was. You know, I know that we got $107 million that's dedicated to flood mitigation. You know, that we're in the planning stages on how to spend it, but nevertheless, you know, Brad, I would say just this, that with the way West Virginia's terrain is, it is absolutely very difficult. You know, I've said it in my State of the States, I think 2 different times. I would dearly love for West Virginia to absolutely build more lakes and use the lakes as flood control, use the lakes for all types of tourism and recreation and everything. You know, it's not really, you know, caught hold, but all we need is the next horrendous rain, and it can come. I never dreamed in my life that I'd see rain like that happened that day, and then all of a sudden, just in a matter of no time, it was a disaster like none other. I mean, honestly, Brad, and I mean this with all my soul, over and over and over, I would go there. You know, right in the middle of a campaign that we completely suspended. And over and over and over, I would go there and go down into town or go wherever it may be, go, you know, to Rainelle or that area or wherever it may be. And I would try to help anybody and everybody we could. You know, I'm very proud, and I don't say this to be braggadocious in any way, but we opened the doors to the Greenbrier Hotel and took anybody and everybody in that we could help. And in all honesty, a bunch of folks walked in there and didn't even have shoes on, you know, because they had to get out of their house or they lost their shoes in trying to get out of the house. It was absolutely terrible, just plain terrible. And in doing so, I can tell you that over and over and over, I left my house and was on the way to Greenbrier, and I would say prayer after prayer after prayer that we could find this little kid that was just washed away, 14 years old, Michaela Phillips. We looked for 6 weeks and then finally found her miles and miles and miles downstream. You know, I said this prayer over and over and over, that if I could just see her and go over, because we knew that we had lost her, and go over and maybe just put my coat over and everything and just call for people to come and help. Because I knew how bad that family was suffering. And I knew how tragic that was. It was just plain awful, Brad. So from the standpoint of putting more money into mitigation to try to do anything and everything we can to try to prevent these disasters from happening, yeah, I'm all for it. I'm all for it. But General, maybe you can add something.
I would agree totally with the governor, where the opportunities present themselves to add more dollars to mitigation and simple things that include cleaning out streams that unfortunately have a lot of bureaucratic challenges to them, are exceptionally important to us going forward and minimizing the tragedy of the things that we see during flooding that the governor and I both experienced up close and personal together. Thank you.
All right, thank you, Brad. Next, we'll go to Bob Aaron with WCHS.
Governor, other than somehow convincing West Virginians to get the shot, is there anything else that government can be doing? There was a study out this morning, or a survey out, that showed us 45th in the death rate, 48 in positive testing, 44 in the vaccination rate, and even though our numbers are seemingly going in the right direction, 47th in hospitalization. Should we be doing anything, or is there any explanation why things have sort of turned around for us here? We were doing so well early on.
Well, Bob, I can tell you that the reason we're doing poorly now versus how we did early on is just as simple as just this. We got after it so fast, saved a lot of lives, and you've got to admit that. Saved a ton of lives. We got after it so fast and so hard and got way, way, way ahead of everybody. And in doing so, everybody's going to hit some wall in their state at some point in time. You know, now you just have states that are slow, but sure, catching up and everything. So, but Bob, from my standpoint, you know, I'm taking any idea, anything, any idea in the world to try to get more and more of our folks vaccinated, any idea, you know, and I'll listen to anything. And if you've got an idea, tell us. I mean, right now, you've got me pleading, you've got General pleading, you've got Dr. Marsh in the same thing with Dr. Amjad. You've got all kinds of our broadcasters that have stuff all over the place. You have us in our governor's office putting stuff up all over the place on the TVs and everywhere. WVU's helping, Marshall's helping, on and on and on. And now on top of that, we're giving away pickup trucks. I mean, we're giving away $1 million a week. We're giving away scholarships and everything. Absolutely, Bob. If you can come up with another idea, we'll put it on top and we'll go with that too. But literally, you got a lot of things going on to get people vaccinated. And we just outran everybody. When it really boils right down to it, West Virginia ran out in front of everybody and everything. And now, in the size of the state and who we are and everything, we had to hit the wall. Everybody's going to hit the wall. But we've got some stubborn folks out there, and we need to get them vaccinated. But if you've got another idea, I'd love to hear it.
All right, thank you, Bob. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, I want to ask a general question and then a more specific question. Number one, the vaccine rollout went very well in West Virginia. You got a lot of good publicity out of that. And now recently on the national stage, you have Senator Manchin being a key vote in the Senate and basically being able on his own to prevent the filibuster from going away. You have Senator Capito going to the White House to negotiate with President Biden over infrastructure. What's your general thoughts on how West Virginia is shaping up as being such a key player these days? And the more specific question is, how is the relationship between you and Senator Manchin these days? Thank you.
Well, Paul, I tell you, the relationship between myself and Senator Manchin is good. You know, I would tell you that I hope Joe continues to hold the line on what's reasonable. We all know that Washington has surely tilted so far to the left in many ways that it's just totally ridiculous in lots and lots of ways. You know, my dad used to say, the United States of America, the pendulum would get out of kilter and it would swing all the way. It would never stop in kilter. It would swing all the way to where it would be completely out of kilter. And I don't know if at some point in time we're going to be strong enough in this country to be able to stand it. But you know, from the standpoint of Senator Manchin, the relationship's great. You know, the same, is great with Senator Capito. I'm really, really proud of the fact that Joe stood up in regard to this filibuster stuff, because that could have absolutely been almost the dagger, if not the dagger, that would have destroyed this country. I'm really, really proud of all the things that we've done in the state. I mean, Paul, if you'll just be fair and just tell it like it is, I don't know how to say this in any other way. I mean, first of all, and I sure don't say words like this very often, but how in the hell do you think we've gotten all this done? I mean, I'll promise you we've gotten it done because we work all the time. We work at it every single minute. I would say, how in the hell do you think we've had 200 and some, of these briefings, and I've been here at every one of them? It's simple. I don't go on vacations. I tell you the truth, don't I? All the time. But, if you look back at just what's going on in this state, This state's doing fabulous, and that's all there is to it. I'm really proud of both of our senators. I'm proud of all of our congressmen and congresswomen. Yeah, they've done really great work, and they're continuing to do so. West Virginia is in the spotlight. And absolutely, of all places, West Virginia. I mean, give me a break. We are absolutely in the spotlight, and people see us, and people are wanting to come. I mean, it's good stuff. It's great stuff. You know, think of just what I announced on our road bond premium. Just think about the Parkway premium of $90 million. And right before that, our Highways Department premium of 62 million, I think. I mean, a premium, I mean, extra money, just free money to West Virginia. Think at how we've managed ourselves all the way through the pandemic, all the way. I mean, really and truly, we may not get it here in West Virginia, but the outside world knows just how good things have happened in West Virginia. And from the standpoint of the economics, of how we've managed the federal stimulus dollars, we've done that right too. And so I really thank the legislature for not balling up and everything in regard to the $150 million we just got on highways. They were great. They did a great job with that and everything. We got more to come, and we got more absolutely working together, and I love it. You know, because I am 1,000% transparent, but it's just taking a lot of hard work, and it's taking absolute good decisions. I mean, that's just, I mean, you know, you can say what you want, Brother Paul, but when you're faced with situations like the state being dead bankrupt or a pandemic hitting you, and all of a sudden in the month of April you lose $199 million, and everybody's screaming, do this and everything, you got to have a calm voice in the woods when all that starts. You got to have absolutely somebody with a lot of experience and a calm voice. But yeah, I'm really proud of our senators, proud of all of our congressmen and congresswomen, and more than anything, I'm really proud of the people of this great state. They listened, they stayed together, they worked really hard, and all of our folks, all of our medical and all the experts that I draw on every day, what an incredible job they've done. And within my administration, we've not done too bad either.
All right, thank you, Paul. Next to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. Thank you for taking my question. So it's been 3 weeks since registration opened for the $100 savings bond / cash cards. And I remember that I registered on the first day, and I checked my mail today, and, you know, I still haven't gotten that in the mail. So I'm wondering, you know, that leads me to assume that nobody else has gotten theirs either. So I'm just wanting any update on that. If these bonds and cash cards are in the mail or if they're still being printed, any update is appreciated.
June, I'll have to get you information on it because I don't really know, but I've been assured that they're going out. Maybe they're hadn't, you know, maybe they're just having some kind of difficulty. I'll have the information before the end of the press conference here and tell you exactly where we are, but just give me a second and I'll find out.
All right, thank you, June. Next to Junate Dill with the AP.
Hi there, thanks. I'm wondering, has the state returned any vaccine doses to the federal government because of hesitancy? And how many doses is the state ordering from the federal allocation weekly, if any, right now? Thanks.
General, please.
Yes, sir. So, Janae, we have not returned any doses. We balance the load of what we need to order based on the requirements for the given week based on our projections. The Johnson & Johnson doses we have segregated to hold those under anticipating that they were going to expire, but now we have another month and a half for the use of those. And I don't have exact ordering numbers in front of me today, but we particularly continue to order Pfizer doses because of the 12-year-old and to 18-year-old requirements for Pfizer.
All right, thank you, Junaid. Governor, I'll turn it back to you.
Okay, June, I just found out we've got 10,000 of the cards in right now that just came in, and they'll be going out at the latest on Monday. So we have 10,000 that have been delivered to us, and we'll just keep pumping them out, right along. The only thing that I think that I've missed is, I want to bring back up, the lady that we lost and the DHHR, folks and everything. A lady from the county that I was from and everything, Greenbrier County, and I guess, that's my main residence here. I guess I'm back and forth there a lot too, and I know that Kathy and I are really appreciative of this beautiful lady. Rochelle Humphreys Evans, 49 years old. 49 years old that served, in the capacity of helping folks and everything for, I think, 20-some years. But I don't know that I know her personally, but what an incredible, incredible service that she gave to all of us. But 49 years old. That's bad stuff, bad stuff. The only other thing I'd like to add, and I really, I don't know if Dr. Marsh or General Hoyer would like to weigh in on this just a second, but without any question, we need to continue on with our interagency task force that we have. We need to continue on funding that and let that lead us into that task force and that level of expertise lead us on to taking on other dreaded illnesses that are infecting the state of West Virginia and continue to be prepared for any whiplash in regard to this pandemic or others. But without it, we talked a good bit about that yesterday out in the parking lot of all places, and all of us have been working on it, and what a job many have done, but especially, Dr. Marsh and General Hoyer, what a job they've done, and it is amazing, what service that's been to West Virginia. But if you two have anything to add, I just wanted to go on the record as saying, that I'm very, very hopeful that we can continue to do that, and I am very hopeful that I can get that done to where we can continue on with our task force, because they've done so good, and now we'll take on the general health of West Virginia. But if you two are y'all still with me? Okay.
Just to make a quick comment, Governor, I think with your leadership and the commitment of so many incredible individuals and interagencies with DHHR and other state agencies, as well as leaders from other sectors, we've been able to respond to this crisis in a way that has really demonstrated the smarts and the innovation and the capabilities of people in our state. And we want to be very cognizant that COVID's not over. We want to be constantly vigilant and ready to respond. But as you said, this is, to me, a golden moment in time where we can take this team that we have constructed under your leadership and your guidance and start to approach the other really challenging health problems of our state. And wouldn't it be great that West Virginia could be a model not only for response to COVID-19 and the ability to navigate this unprecedented crisis, but also a state that could then lead in the health of our citizens. And that's something that we very deeply believe in as a future frame for West Virginia under your leadership with the legislature and other leaders in the state, but also what a legacy to give people different levels of hope and a different life for the future. So we are committed, we are grateful for your leadership, and we believe that this is the best possible potential of the team that we've constructed for the state. Jim?
Clay, I think you said it well, and as the governor has used the task force construct to get us through state disasters as well as Boy Scout jamborees and world jamborees and now pandemic, and the team from DHHR to the National Guard to our universities and all of our state partners are prepared to follow the governor's lead and use this construct to improve overall health and wellness of the people of West Virginia and create a new legacy for our state.
Okay, Jordan, if you come back to me just 1 second. Again, there's two rascals that just talked and everything. Boy, how good have they been? And so, General and Doctor, thank y'all, and thank all the experts. I just want to spend 1 second to go back to, I think Paul's question and everything, but I just want to make one other further statement, and that is just this: West Virginia is doing really good, and we really need to not be hung up on Democrat and Republican. We need to be hung up on continuing for this great state to continue on doing good. There's lots more we can do. We've done a ton. We've done an absolute ton and then some, but there's lots more that we can do. And I want to thank, Senator Manchin, Senator Capito, all of our congressmen and women, whether it be Congressman McKinley or Congressman Mooney or Congresswoman Miller. I thank them with all my soul. I thank all those that are upstairs, the legislature and the Senate, the House, and all the good stuff that they're doing, and to make all these things happen. And I really thank the experts that have helped guide us through all this terrible pandemic. Thank all my staff, but really and truly, there's so many that need to be thanked, especially those that are out there on the front lines. When it really boils right down to it, we've lost 2,848 people. We lost a 49-year-old beautiful lady that absolutely has served this state, and we just lost her. Absolutely, without any question, all those that crawled out of the bed and walked right to the fire, courageous is the understatement of all time. All those first responders, all those folks that walked right into the fire, even those at the grocery stores that helped us in every way, we need to have a debt of gratitude like we have never had before. So absolutely, I know I'm missing people and everything, and please forgive me. Please forgive me, just think of our school teachers that went every day. Every day that we asked them, they went. All those from our service personnel right on down. And I know I'm kind of rambling on and everything, but truly they deserve any type of recognition that you can give them. Saved a lot of lives. I couldn't thank them more. So nevertheless, we're just going to keep at it. We still got a lot to do in this state. We're going to keep at it. Hopefully we'll just keep compounding the good things that are happening. Thank you so much.